So good morning, and thank you all for joining us. My name is Marna Borgstrom. I'm the CEO of Yale New Haven Health, and I am really delighted to welcome all of you to Yale New Haven Hospital today to talk about something very important, and it does not begin with C. We are not here to talk about COVID, but we are here to talk about something really serious, which is a national shortage of blood products that is particularly severe in our own state of Connecticut. Having an adequate supply of blood products is critical to hospitals and to our patients, one of whom you're going to hear from this morning. Today, we're joined by the Governor of Connecticut, the Honorable Ned Lamont, by the Lieutenant Governor, Susan Bysiewicz, by the COO of the American Red Cross, Richard Brannigan, by Nicole Donzello, who is a patient at our own Smilo Cancer Hospital, and our Chief Clinical Officer in the Yale New Haven Health System, Tom Balsazak. Connecticut's hospitals, not surprisingly, are the major recipients, users of blood products that our local Red Crosses distribute. And we appreciate that hundreds of units per week come to us through the generosity of donors. A lot of times when we hear about people giving the gift of life, we think about solid organ donors, but everybody who donates blood gives our critically ill and injured patients the gift of life. But we need more blood. I feel a little bit like a vampire in saying that, but we have to have people who are willing to give blood. Fewer people are giving now than they have in the past. You can speculate as well as I can on the reasons. Is it COVID? Is it illness? Is it just the general fear that people have about being out in public? We've held this press conference to be socially distanced, and the Red Cross is doing all of their drives with great respect for social distancing, for mask wearing, having an abundance of hand sanitizers available. So we believe that the risks of giving are quite low and the reward in giving is quite high. So it's now my pleasure to introduce the Lieutenant Governor, Susan Bysiewicz.
Marna, thank you so much. It's great to be here with the Red Cross and the healthcare heroes here at New Haven Healthcare. January is National Blood Donation Month, and we're here at a time to celebrate this month by asking the people of Connecticut to come forward at this time where we have a national shortage of blood. And we know that the people of Connecticut have been extremely generous every time we ask for food donations to our food banks. Today, we're asking for donations to the American Red Cross because donating blood is really donating life to ill patients. Much like wearing a mask and getting vaccinated, donating blood is another way to fight this virus. People who are sick with COVID may need it. We have many other ill patients across our state, and many potentially who will be injured who need blood. And so we are asking you today to please come forward and give blood. I want to just share a personal story, how blood can be life-saving to people. My mother-in-law, Annie Laurie, who lived with our family for almost 20 years and helped raise our 3 kids, developed lymphoma. And as part of her treatment, she needed regular blood transfusions. Now, I don't weigh 115 pounds, so I can't give blood, but my husband, fortunately, weighs twice as much as I do. And in honor of his mother-in-law, he regularly gives blood. And he's been doing that in the years since she passed away to honor her memory, because it was something that was life-saving to her when she was very sick. So I share this because I know that a lot of families sadly have had cancer patients or people with chronic diseases that need blood. So please, please, please do call the Red Cross. They're everywhere. They make it easy for you. It's extremely safe, and it's something that you can do to improve the lives of others and to help our state get through COVID. So please visit redcrossblood.org or call 1-800-RED CROSS so that you can help us. Thank you so much.
Thank you, Lieutenant Governor. It's now my pleasure to introduce our Chief Clinical Officer, Dr. Thomas Balsazak. Tom.
Thank you, Marna, and thanks everyone for coming today. Thanks you, Governor. Thank you, Lieutenant Governor. Thanks to the Red Cross. This is really a very important issue for our patients, our doctors, and most importantly, our communities. Here in New Haven, we use a tremendous amount of blood in the care of patients. We use between 80 and 100 units of packed red blood cells every single day. We use 50 doses of platelets and 50 doses of plasma and cryoprecipitate. That's an incredibly important resource for our patients, and it's incredibly important for us to maintain, as a community, a healthy blood supply in order to continue to care for our patients. On top of that, we occasionally have incredibly important mass transfusion events that occur. That means that we give more than 10 units of packed cells to a patient in a very short period of time when there's a bleeding emergency or when there's a trauma. This uses an enormous amount of blood. We are very careful stewards of this resource. We work very closely with our doctors in our laboratories. They do an incredible job of making sure that no blood goes wasted, no blood expires. But still, we need more. We especially need type O negative and O positive. 40% of the population is type O. It's also, those are the universal donors. So we use a lot of type O blood. We're at the point now where our creative physicians and staff in our laboratory are very creative and very careful in how they steward that very precious type O resource. They very safely and sterilely split those type O units, and we use them judiciously to allow special surgeries in vascular, transplant, heart surgeries to be able to go forward while still maintaining that adequate blood supply for patients that have emergencies and trauma. These are all very important for us and our patients and our community, and it's really quite important that we maintain this blood supply going forward. This is not just a one and done today on this Wednesday. We always need a blood supply. This shortage has likely to go on for months, and we've always been sort of at the edge of not having enough blood. This is nothing new. But what's changed, as Marna and others have mentioned, is with COVID, for whatever reason, we've seen fewer donations, and therefore it's putting a real pressure on our blood supply. Our lab directors, our blood directors, our blood transfusion center directors meet on a daily basis to look across our health system and make sure that we have adequate blood. And we actually sometimes have to hold back on surgeries to make sure that we have enough blood for those surgeries. This is incredibly important. Donating is easy, it's safe, it's relatively painless except for that one needle stick. And here's the place to go to get it. This is where you should go, redcross.org, to be able to sign up for a blood donation. So with that, thank you very much. Please go out and donate, ask your friends and neighbors, and we very much appreciate it. Thank you.
Thanks, Tom. An important message. And it's now my pleasure to introduce Richard Brannigan. Richard is the Chief Operating Officer for the American Red Cross's Connecticut and Rhode Island region.
Thank you, Marna, and welcome, Governor, Lieutenant Governor. Always nice to see you, and don't take it personally. I hope I don't see you this weekend with the snowstorm that's coming. Good morning, everyone. I'm here on behalf of Mario Bruno, who is our Chief Executive Officer, who is actually out on medical leave these days. We brought our team together, and we're honored to be here at Yale New Haven Hospital. The American Red Cross, like the rest of the country, is facing a national blood crisis. Certainly the worst that we've seen in my tenure of almost 10 years with the organization. Since we've issued our blood crisis alert, we've witnessed the generosity of blood and platelet donors across Connecticut. So many have opened their hearts, put on their masks, and rolled up their sleeves to help ensure patients counting on blood products and transfusions can receive life-saving care without interruption. But as winter presses on and as COVID presses on, unfortunately, blood remains at dangerously low levels. To put it into perspective, we at the Red Cross, and Doctor was referencing the amount of blood and the shortage, we're comfortable when there's a 5-day supply of blood. We don't have that comfort level right now. We're looking at 1 to 2 day supplies of blood sometimes. And that's alarming to us, and that's why we've declared this national emergency in our world. Every community in America needs blood. And as we're facing these COVID challenges, that will continue. And we're no different than any of our colleagues and any of the hospitals that are out there. We've focused, as Marna was saying, on the safety of our donors and our staff and our volunteers, and we want to make sure that everyone is comfortable when they roll up their sleeves. But this is a community health crisis, and in the midst of a global pandemic, it will take a community to solve this crisis. We thank our partners like the governor and the lieutenant governor, Yale New Haven Health, and the members of the Connecticut Hospital Association, and those who have opened their doors to host blood drives every day, as well as the healthcare heroes, many of whom are here in this room and those who are in this building today and others, including our own phlebotomists, that wake up every day committed to being part of a solution during this challenging time. As you have heard, the leadership at Yale New Haven Hospital is responding to this crisis with all the tools in their immense medical bag to help people, and it's been truly remarkable to watch your leadership in action, and hopefully the other hospitals and healthcare systems will adopt their same practices. We couldn't be more proud to be part of the state's unified command. We respond to disasters 24/7. We hope there's not a disaster soon, but during this pandemic, it's been amazing, and on a personal note, to see everyone rallying together and pulling together in the same direction. It does take a community, and the community here in Connecticut is strong and vibrant, and this is another example of the community at work. We thank you for making a donation potential. We appreciate signing on to our website. Doctor mentioned that it's very easy. You can also, as I have in my pocket always, my cell phone and my Red Cross blood app, that I could make an appointment. My last appointment took me about 30 seconds to make, and it's for Milford at our new donor site coming forward. So we'd like to, as Marna was saying, ask people to take a stand, as Lieutenant Governor referenced. This is something that folks can do in the community to fight back against COVID, to help people that they don't know and that they could actually save a life. So thank you for coming together as a community today to make this happen.
Have to keep remembering to take off my mask. We've gotten so they're part of us. Thank you, Richard. You know, there's no better way to really understand the need for blood products than to hear it from somebody whose life has become somewhat dependent on them. And so it's really an honor to have Nicole Donzello with us today, who is a patient here at the Smilo Cancer Hospital.
Thank you, everyone. Thank you, Governor, Lieutenant Governor, for being here. My name is Nicole Donzello, and I was diagnosed with acute monoblastic leukemia in February of 2007. I'm coming to my 7-year anniversary in a few weeks. I have been treated through many different methods. I have received 2 stem cell transplants. I have undergone numerous chemotherapy regimens. I have completed radiation, you name it. I've pretty much checked all the boxes for leukemia treatment. My leukemia is very resistant and stubborn, some would say, like I am. So that's why I'm here. So the common denominator in all of my treatments for leukemia is the necessity for blood products. That includes platelets as well as blood. And, without it, quite frankly, and I'm sure the doctors can explain this to you more eloquently, we would not survive. The purpose of our treatment is to essentially destroy all the cells, good and bad, within the bone marrow, with the hope that as it regrows, that all healthy cells come and not cancer cells. With that, however, for approximately, in my experience, 3 weeks, we are solely reliant upon donors' blood and platelets. Our bone marrow is not able to make enough to sustain life for us, and as a result, it is a necessity. You may hear things, and again, the doctors will tell you, but of course, after 7 years, I kind of dub myself an amateur doctor at this point, but without the platelets, we could have excessive bleeding internally, cutting your finger can result in an emergency department visit, which is what happened to me personally. Without the blood, we cannot have oxygen traveling throughout our body, and as a result, we could be looking at things such as cardiac arrest. Now, personally, I received through at least 5 of my 7 years 155 units of blood products. Think about that. 155 units. That would be 70 blood units and 85 platelets. I'm only one person with one diagnosis of AML. The Leukemia Lymphoma Society had projected in 2021 that there would be approximately 178,500 individuals diagnosed with blood cancer. Multiplying that number by just what I experienced, 155, is astronomical. And that is only blood cancer. As we talked about earlier, we have other health issues that we have. We have other cancers. We have heart conditions, surgeries, traumas, all sorts of different scenarios where blood is needed. Now, I'm sure you all can imagine how fearful and how petrified I was, and many people are, when receiving the news that you're diagnosed with cancer. It's just unimaginable, and I truly hope that those of you who have not experienced that never have to experience that, or your families. It's just not only scary being diagnosed, but then you have to go over the side effects of the treatment that you're about to receive. And side effects for leukemia, for example, because of the significant amount of chemotherapy, stem cell transplants that we may potentially receive, those side effects can be something minimal to a rash on your skin to death. Now, with this blood shortage, we are now going to have to be fearful that our treatment protocol is going to have to be modified because we will not have enough blood to sustain us for the weeks that we have to wait for our bone marrow to kick in. We now have to be concerned that if we are able to continue with the protocols and treatment that are out there for us, that we will not be able to stay alive for those 3 weeks until the bone marrow kicks in. These are added stressors and added fear that none of us need to face. And this is just a leukemia, but this is for any diagnosis that requires blood. It's a shame that with all of the advancements that we have made over the years in cancer treatments and trauma treatments and cardiac treatments, that here we are putting these advancements at risk for something as simple as a blood donation. One thing I learned when I was diagnosed with cancer is that I had to relinquish control, which is very difficult for someone like me with a type A personality, I'll be honest. But I had to relinquish control. I had no control of my diagnosis. I had no control over how my body was going to react to the treatment. But what I do have control over, and which is why I am here, is to encourage everyone out there to please donate blood. It is a simple process that will take you only an hour of your time, and you will literally be saving a life. And I would like to personally take this opportunity to thank each and every one of you donors out there, because if it was not for you giving that blood, I would not be here today speaking to all of you and having the opportunity to spend all these years I have with my family, my children, my husband, my parents. So from the bottom of my heart, thank you, and please donate. Thank you.
There's nobody who could have said that better. Thank you so much, Nicole. That was amazing, compelling, and I hope I see people on their apps immediately. It's now a real privilege and honor to introduce our governor, the Honorable Ned Lamont.
Well, thanks, Marna. And Nicole, the legislature sometimes say I'm kind of an A1 personality, a little reluctant to give up control as well. But life moves on, and we're making those changes. I want to say, first of all, that everybody involved at Yale New Haven, and Marna in particular, you guys have been extraordinary partners for the state of Connecticut going on now 2+ years. We've been through a lot. We led with science. We led with all your incredibly good advice and work together. And for that, we'll always be appreciative. We're making real progress. And hey, Tom, I'll get you one of these great N95 masks. They're really effective, by the way. Just give you a heads up. Let me just say, Nicole just reminded us, whatever has happened this last 2 years, life didn't stop. Education had to keep going. Cancers didn't stop. And we've had to work hard to catch up. And I was telling, Marna on the way in that our infection rate continues to go down, less than 12% today, less than 11%, 10.9%, which is about half of where we were a few weeks ago. And as Marna and I were talking about, even more important, I think, is the fact that we're getting a little more relief, COVID-related relief at our hospitals, down another 100 hospitalizations today, specific to COVID. But Nicole reminds us that just means we have to take care of all the other maladies out there along the way and make sure those beds are free and make sure we can take care of people. And we got close over this last few weeks and close over the last couple of years. We've always been able to stay just ahead of the curve there and to make sure we're taking care of folks. And I just realized that I'm a business guy, a lot of it's, related to supply chain and making sure we have all the ingredients, all the tools, all the pieces we need to keep people safe. And that's particularly true when it comes to surgeries, and it comes to cancers, when it comes to what's going on in your hospital rooms. And there's not a lot of room for error. There's not a lot of margin there. And I'm just, boy, you used a lot of blood. And it's just reminded of, a change as strong as its weakest link. We got to make sure we have all the tools we need, make sure we have the beds, make sure we have the nurses, make sure we have the doctors, and make sure we have the blood to take care of people. And look, our amazing partners at the Red Cross, I just want you to stand up. They're incredibly selfless, working on your behalf every day. I need you to go to redcross.org. I need you to do the most selfless thing you can, which is donate blood. Keep folks like Nicole happy and healthy and going forward, and all the other hundreds of patients here who desperately need this life-giving blood. And it's easy to do, it's safe to do, and why don't you do it before the snowstorm on Saturday and save yourself a lot of effort. Appreciate everything Yale New Haven does. Give blood. Thanks.
That's great. And thank you, Governor. It has been a great partnership. And hopefully COVID will largely be in our rearview mirror, but the need for blood is ever present. And for emphasizing that, we're very grateful. Thank you for attending the press conference. Thank you to all of our speakers, Lieutenant Governor Tom, Nicole, Richard, really made a difference. We appreciate your presence, and we would encourage all of you to work with our media staff who are over to my left, and we will try to make sure that you have a chance to speak with whomever you would like to. So thank you all for coming, and give blood.